Hi there, it's Dr. Tamara here, and I want to talk about the fertility workup. About 1 in 6 couples will suffer with couple subfertility. The definition of infertility or subfertility is 12 months of regular, unprotected sexual intercourse without conception. And for a couple where the woman is over the age of 35, we give you 6 months on this to try and conceive with regular, unprotected sexual intercourse. So at that point, it's really reasonable to move forward with some basic investigations to assess fertility. And I think there's three big rocks that you can move forward with really quickly that will help you to decide whether you need to move on and see a fertility specialist. The first thing is, are you ovulatory? Many women come to me and state that they have a really regular period, but that doesn't necessarily mean that they're ovulating. So, doing fertility apps and assessing temperature change and cervical mucus may be helpful, but they are not particularly accurate in determining ovulation. So, it would be my recommendation that you figure out approximately how long your cycles are and get a mid luteal blood test to look and see if you have ovulated. That mid luteal blood test is a blood test that's done about a week. That doesn't have to be exact, but about a week prior to your day one of your menstrual cycle. So figure out perhaps over a 3 month period of time, approximately when that will be, and then go and get a blood test. And if you have a raised progesterone, then yes, you would have ovulated. That's the first test. The second assessment is, do you have open or patent fallopian tubes? In order for the egg to reach the sperm where fertilization occurs, the tubes must be open. So you can do either an HSG or an HyCoSy or even a diagnostic laparoscopy with a specialist to determine tubal patency. So I think that's another really important test. And the third big rock I think is important is to assess the male's fertility by doing a semen analysis. About 15% of infertility is male related, and so it is really important for us to assess the male. And so most GPs will be able to organise a semen analysis, which is done somewhere between day 2 and 5 of abstinence, can be performed at home and taken straight to the laboratory within an hour. And they assess how many, the concentration, they assess the motility, how they move, and also how many of them look normal, and compare them to the World Health Organization averages for a normally fertile sample. So just getting those tests alone, those three big rocks, is really helpful to a couple. And then if they are looking for other things that might be affecting fertility, it's valuable to head along to a fertility specialist for more comprehensive testing.